welcome to the discussion today. We wanted to have Gallagher Benefit Services join us today to kind of help us get some information out to the college on what is happening with a recent procurement. Ed Ibarra's spearheaded a procurement that is looking at sort of our current situation with health and medical benefits, and we've embarked on this procurement to just kind of look at seeing, what options may be out there, trying to consider what we're getting with NIPIA, our current provider, and we're just trying to see through this procurement, and this is what the procurement office adds value to the college in terms of looking at these, making sure that we're getting the best rates for our employees, as well as just testing to see what is out there in the market. So it's been an interesting process. We've been working with CNM in Albuquerque to go through this procurement process, and we've done that because we knew that CNM was going to take a look at this same situation. There's a lot going on with healthcare, as you all know, a lot on the state level and federal level, and it affects each one of us in here. So I think that that's the impetus for embarking on this project, this analysis. So CNM decided to see what's out there through procurement, and they contacted us, and we've been collaborating. And the reason why we were interested in that was because, with buying power, CNM has many employees. How many did they have? About 1,800 employees combined with our 300 or so employees. That offers a lot of buying power. So we thought that it would be beneficial for economies of scale, leveraging our buying power to see if this would work for Santa Fe Community College. So with that, those are my comments. I'll turn it over to Don Hillman, who's with Gallagher Benefit Services.
Thank you, Nick. And I'm also here with my colleague, John Hatz. If I put this down, can you hear me back in the back? No? Okay. Darn. Thanks. I thought I'd try. Again, we're certainly here to share with you the process that we've gone through, the methodology, and then what we see as kind of just the process going forward. So no decisions have been made by any stretch of imagination, but hopefully what we'll do is just give you some idea of how the process is going and the thought that is going into this, just so that you're very familiar with it and comfortable with it. The other thing that I can share with you is from a standpoint of CNM. So CNM, as kind of the owner of this RFP or procurement process, we have obviously followed their rules. We've been asked to sort of follow a process which is very confidential. We've been asked to sign non-disclosure agreements, and so unfortunately we're not able to share with you much detail at this point. But we are in the process, and I'll give you an idea of where we're at thus far, hopefully give you an idea of what we're looking at, what are some of the key considerations, and then certainly open it up for questions, and I'll ask my colleague John to join me as well. So again, as Nick mentioned, why did Santa Fe Community College undertake this process in the first place? And first and foremost is, you joined NIPIA in, I believe, 2005. A lot of things have changed, and for those of you who are not terribly familiar with NIPIA, it is really a purchasing pool that was created by the legislature several years ago, primarily to provide a basis for primary and secondary education, K through 12, to consolidate, aggregate, and provide benefits for their employees. And then by choice, the legislation provided an opportunity for higher education to elect to participate in the program. And I believe 2005, Santa Fe Community College made that election, okay? So having been in NIPIA for those 12, 13 years, a lot of things have changed, a lot of dynamics have changed, and so I think that was kind of one of the impetuses is, are we still getting the best bang for the buck? Does this make sense for Santa Fe Community College in a pool that is primarily serving K through 12 employees throughout the state of New Mexico? So that's really the first question, and I certainly think that makes sense. The second option, I think, is to say, both from a cost standpoint, but also from an option standpoint, what are options that are out there that maybe we should consider? Because again, if you're in a pool such as NIPIA, what you basically are buying is what NIPIA decides, right? So they're selecting the carriers, they're making the plan designs, and then you go along with them so long as you're in NIPIA. So part of the question also from an employer's perspective is what NIPIA is providing us necessarily what we think is in the best interest and what we should be providing our employees? So it gives a chance to sort of take a pause, if you will, and look at that as well. And I think the third thing is, as Nick mentioned, is are there opportunities to look at if pooling is good, is NIPIA necessarily the best pool? Are there other pools, are there other collaborative arrangements within the state of New Mexico that might better serve or better fit the needs of our employees? So those are really kind of the three primary thrusts that we tried to address as we kind of embarked and designed this process jointly with CNM. So again, what we've done is a very formal process. We developed a formal RFP process, and the first piece we asked is to every carrier that we went out and solicited proposals from, every vendor, we said, what would be the best offer that you can make to Santa Fe Community College, irrespective of what CNM decides? So basically saying, we are the purchaser, tell us what you will do for us. And it involves all benefits, because if you were to withdraw from NIPIA, essentially you are withdrawing in entirety for purposes of employee benefits. So today you get medical coverage, you get dental, you get vision, there are some life and disability benefits. If you were to pull out for one, you really need to pull out for all. So we had to do a very comprehensive assessment of that entire array of services, okay? Then, as we then worked with New Central New Mexico Community College, we then said, CNM asked the same question for them. They said, what's in it for us? And then we asked, as a second layer in the RFP, should CNM and Santa Fe Community College both select you as a partner, as a business partner, would the cost or the terms that you've offered improve any versus what you would have given us on a standalone basis? So again, trying to use the leverage of CNM, quite frankly, in your case, to maybe improve your purchasing power and your buying power a little bit. We then asked New Mexico Public Schools Insurance Authority for historical claims data, not on an individual person-by-person basis, but just financial data in aggregate historically, and shared that with them, because what we wanted to do is make sure that an insurance company wants to know what they're taking on in the way of risk. And the best way to show them what the risk is, a very good indicator, not a perfect one, is what has happened recently. So what we did is we requested that data, sanitized it to make sure there was no confidential or proprietary information in there, and shared it with them so that they could have a more informed way to give us the best pricing possible. So that data was there, and that also then helped us work with Santa Fe Community College in understanding what some of those dynamics are, because we could also then compare it back to how that compared to NIPIA as a whole to see what that seemed to suggest as well. Okay? So we went through that process. The other thing to make sure you understand is, again, I mentioned under a pooling arrangement with NIPIA, basically you are buying what they offer. If you were to pull out, certainly there are a wide array of plan design options that you could choose from. You can improve your benefits, you can reduce your benefits, you could change your benefits. But for purposes of apples-to-apples comparison, the point of this exercise is not necessarily to change what's being in place today. And in fact, to make sure there was an apples-to-apples comparison, when we went to all the carriers, what we said is, here is what the current plans are today. Assume that you are replicating those plans. So again, the exercise here is not to say, well, instead of buying a Cadillac, we're going to buy a Yugo and tell us if we can save money. We suspect you can save money, right? But what we're saying is, if we're buying the same bill of goods, what would that cost us if we were pulling out an NIPIA? So the goal is that. It's purely to compare apples to apples on that basis. And then the last piece we said for completeness is, we've worked as consultants in New Mexico for many, many years. We understand the public employer space, the higher ed space very, very well. And we know that there are other pooling arrangements, and quite frankly, we even thought about other joint purchasing arrangements. So for completeness, what we also helped both Santa Fe and New Mexico Community College do is to go to other existing vehicles or arrangements or potential partners and say, look, if Santa Fe Community College was to pull out of NIPIA and come to you and decide to either enter into your pool or partner with you, what are the options for doing so? So again, we could even look at, if we don't want to pull out, but we don't necessarily believe NIPIA is the best answer, is there a better pool that maybe instead might work? And the short answer is we really didn't get any compelling responses back that suggested either A, an interest, or B, a compelling offer. So we're now kind of back to either staying with NIPIA, doing something on a standalone basis, or potentially doing some type of a partnership or collaboration with C&M. So that's kind of where we're at a structural level today. Does that make sense? Okay. So, like I said, what are the key considerations? Well, cost is obviously one. And what we're doing here is NIPIA has sort of stated or set forth what the premiums are. They haven't been formally ratified, but preliminarily what they believe the premiums will be for 2018. So that was our kind of anchor in the sand. Everything's kind of being compared against that, because if there were a change to be made, it would become effective January of 18. So we want to compare 2018 to 2018. So we're looking at costs. The other piece is, as I mentioned, control and flexibility. So to what degree is there value from an overall standpoint for Santa Fe Community College to essentially contract directly with a provider or more than one provider, and then have the ability and control to decide, well, we want to structure that plan a little bit differently, or we want to look at this feature a little differently. What are those types of opportunities worth? The other piece is to think about, are we designing a plan that really is tailored to what we think is important for us to be successful from a human capital and total reward standpoint in higher ed? You know, there are different pressures. Certainly everybody has their pressures today, but there maybe are different pressures in a higher education setting than there is in a K through 12 setting. So if that's important to us, then let's not lose sight of that. And then biggest piece we looked at, because again, we're not talking at this point at all in terms of the analysis and the comparison in plan design changes. So we're not looking at increasing deductibles or changing copays. It would basically be status quo unless somebody made that decision to change. But for comparison purposes, it's the same. However, as we all know, if you work with a insurance company, they have went out and established a certain set of providers that are considered in-network. Private carrier B has a different set of providers. If you, and through NIPIA today, obviously you offered 3 different choices, which essentially gives you access to 3 different network configurations. If we pull out of NIPIA and we don't work with all 3 of those vendors, then what could be the potential consequence to employees of not being able to see the doctor they did yesterday? So that certainly is a piece that we are looking at and taking into consideration and sharing that information with the decision makers as well, okay? And then the other piece is, are there additional needed resources? If we pull out a NIPIA, what additional administrative load does that create for Santa Fe Community College to then continue to offer the benefits and administer the benefits without kind of the umbrella, if you will, that NIPIA creates for you? So we wanted to make sure we didn't lose sight of that as well, because that's a part of the equation as well. So all of those things have been discussed and shared, and using our expertise and our experience, giving an idea to Santa Fe Community College of, if you do this, then so what? What happens, and are we prepared, and what's the impact? So again, we've been attempting to be as thoughtful and comprehensive in the thought process as we can. Okay, so where are we at? We have received the original proposals. We have analyzed those proposals. The committee that was formed has scored those proposals. Finalists, in many cases, have been selected. We've interviewed, at least for medical, those finalists. We've gone back to them and asked for clarification. We've gone back to them and now asked for what we call a best and final offer. We received that best and final offer late last week. We have put that together and kind of updated the original analysis, and we have shared that with the two bodies. So that is in their hands. We have not yet had a chance to discuss with them what their response is to those best and final offers. That's where we're at as of point in time. Okay? As far as preliminary findings, again, because it's a confidential process, because it's still premature, we're not in a position to share with you what the specific findings are, but what we can say to you is we have seen a pretty dramatic range in potential all-in costs compared to NIPIA. And you'll see there we've shown, and this again takes into account the lowest possible bid in every single line of coverage. So if you look at medical, dental, and vision, and you look at the absolute best rate to pick in the highest, which of course no one would do, but just to give you an idea of the variability here, we show you kind of the worst possible case scenario, which of course doesn't matter much, but for completeness, just to give you an idea, we've showed you what the range of costs are. So theoretically, what this would suggest is Central Santa Fe Community College could make a decision to move out, and if they picked all or the majority of those lowest cost options, there would be potential savings on the table to be realized. I don't know why you would do it, but if you picked the most expensive options, you certainly would incur substantial more costs. So obviously leaning towards the right, there are some savings. So now the real question becomes is what are those savings worth? What will that mean in the way of consequences to the college, to its employees? And that's the part that is now being carefully scrutinized and evaluated. The other thing, as I mentioned before, is you have 3 carriers today. It is looking today, at least if Santa Fe Community College were to make a decision on their own, independent of CNM, it would seem to suggest potentially, not absolutely, but potentially that you would have to narrow the range of carriers. So you wouldn't be able, in all likelihood, not necessarily a final decision yet, but you wouldn't in all likelihood be able to offer all 3 carriers to employees. So that would be requiring you to pick carrier A, B, or C, or D, or whoever that is, okay? So within then that discussion, plan design is not an issue because plan design is the same. So the next question is what does their network look like and what would that mean? And if there's a change, how would we manage a change, okay? So those are some of the things that are being looked at right now as well. And then last piece, as I mentioned already, there really did not appear or no other viable pools outside of staying with NIPIA really surfaced. So we've that's been the easy part of this all is we've dismissed that scenario because of just nothing presented themselves. So where are we at going forward? Here's where we're going to be going. We're going to be reviewing tomorrow with the committee the best and final offers, making sure they understand what has changed, where we're at, as best as we can possibly identify. Here is where we stand today, and helping them begin to then kind of process this and arrive at either some decision points or at a minimum to then enter into the next phase, which may be then kind of what I would consider true negotiations with a potential selected vendor. If we select the finalists, it doesn't necessarily mean we're committing to them, it just means we're now entering into even additional discussions. So that's kind of where we're at from that standpoint. We would conduct those negotiations, see where we end up. If we can get to a place where everybody feels good about it, then obviously there would have to be a formal decision to A, select 1 or more carriers. We would then have to notify NIPIA if that decision was made because there is a certain time frame that would be required in order to comply with their requirements. And then we then still have to go back and say, okay, now that we have made the decision to have our autonomy, the question then would have to become, what are we doing with the autonomy? Do we keep the plan designs exactly the same as they are for NIPIA today, which is certainly a possibility, or the decision could be, you know what, there are some tweaks we have always been wanting to make or that we would like to make or that we think we should make. Let's go ahead and make those tweaks to the plan design, not because we have to, but because the choice would be made. So that would be a separate decision that Santa Fe would then make if they choose to come out of the pool. And then what would happen is we would then finalize all of those features, what the corresponding costs are going to be, and then we'd obviously have to start going through the communication process to let you know exactly what's going on, and more importantly, the transition and implementation process between essentially September and December, so that by January 1st, you have an ID card in hand and you are assured the benefits that have ultimately been determined. So a lot of work to get there, but more importantly, the next month or so is going to be the kind of the critical point at which some decisions really will be made and will need to be made. So at a high level, that's where we're at. So again, to summarize, it's not an absolute that we're moving from NIPIA in any way, shape, or form. Number two, we're not necessarily looking at this as a way to change plan design, although it could be possible, but that really isn't the issue driving the discussion at this point. And there's a lot of work going on right now behind the scenes to try to flesh out what are the pros and cons, what is a logical decision, and keeping in mind this is not just a 12-month decision. The real thing that we're trying to encourage Santa Fe and CNM, for that matter, is to understand is what's the long-term consequence? Because you don't want to be moving out and then a year later saying, you know what, we weren't that serious about it and let's jump back into NIPIA in a year from now. I think this is really a strategic decision that we hope people are kind of taking that context to decide what is the basis for delivering hopefully what we consider to be competitive, cost-effective benefits to our employees going forward. So with that, unless there's any other comments from leadership or purchasing or Nick, we're more than happy to turn it over for questions. Anyone? Yeah. The current cost is kind of not clear. So what happens is, well, what we know is the premium, because they basically design, they publish the premium, and then Santa Fe Community College pays a certain percentage of the premium, and the employee pays the rebalancing percent. So within that premium is an all-inclusive cost. So everything that it costs to have NIPIA do what they do is built into the premium. So you don't have a separate fee, but that doesn't mean they're doing it for free, right? So it's kind of hard because we don't have access to all their detailed financials to show how they built up their premium rates. But the bottom line I can tell you is there is really three essential layers of cost that not only NIPIA but anybody's going to have. Number one, they have certain staff and resources and people and systems and buildings and rent they have to pay for. That's a cost. The more people they have to spread that cost over, generally speaking, that helps them and their membership, right? The second cost is because they are fully self-insured. So what that means is they aren't going to the carriers and saying, what is the rate that you will charge us each year for the privilege of offering benefits? They are basically their own insurance company. So they basically just go in contract with Presbyterian or Blue Cross Blue Shield or New Mexico Health Connections. And essentially they just are charged, they negotiate with them an administrative fee. And the administrative fee then basically pays them to do all the things they do. They pay claims, they build networks, they manage care, whatever it is that they're doing. So that's the second layer of cost. And then they also use a third party called ERISA. You may or may not see that. That's kind of more of an administrative vehicle to help all of these pieces come together. That cost is built into it. And then lastly is the cost of claims. And that is by far and away the greatest share of the total cost of the premium. And that is what each of you are using when you go to your doctors and hospitals and pharmacies, and those claims are submitted to the carriers pay the claims, and then they go back to NIPIA and say, here's how much we paid, now reimburse us because it's not our risk, it's yours.
Let me add to that. Nick or Ed maybe, we spend just over $3 million a year for healthcare coverage. But is that the total cost that includes the employer share and the employee share?
Yes, about $3.2 million.
3.2 million.
Just medical, so that's just medical. And then there's some other programs that also cost, but purely medical all in, yes.
So what is NIPIA's administrative fee for that?
Again, I don't know that I have that in great detail, but it's.
I'm sorry.
What's that?
Every
Well,
insurance company's a short.
Yeah.
Yeah, I just would like to see what they are doing versus if we went on our
We
own.
can't give the details out because it's a procurement.
Yeah.
Oh,
It's, the large majority of their premium cost is the claims, just like any insurance company. That's where the rubber meets the road, right? Yeah.
So you had mentioned, I think, that
NIPSIA is doing now, what we're paying NIPSIA to do in administering the plan, the college would have to do.
Right. Generally, although again, because what NIPSIA is doing is creating broad kind of policy oversight and kind of managing the finances of the program, but they're in turn contracting with third parties to do all the work. So in many large respects, we're still looking to have, you're still, whether it's an insured product or a self-insured product, you're still hiring or contracting with third parties to do the great majority of the work. So that doesn't change as much as one might think. For example, today, your HR staff still has to decide who's enrolled, who's selecting what, who's picking what. They have to send that to somebody who then basically sends it to the insurance company so that they get it in their system so that you're covered, right? You still have to send it to somebody. In this case, instead of sending it to somebody who then sends it to the insurance company, really the only difference is Santa Fe would now be sending it directly to the insurance company. So it's really no additional work. You're just going through a different channel, okay? And there's other pieces certainly where there is more of a burden in negotiating with vendors and making sure you're addressing compliance matters and those kind of things. And that's where typically all of our clients would hire us to do a lot of that kind of compliance technical work that really is sort of built into an insured premium anyway. So those things aren't having to be taken on by the college. They have to be addressed, and typically the way you do that is through a third party, and hopefully it would be us if you decide to move down that path, but however that process flows, that is all handled. So really the bulk of the services change a little bit, but it's really not meaningfully different than what you do today. You still have to facilitate communication to employees. You still have to take employees' elections and communicate them to whoever it matters to. So those day-to-day administrative procedures are still there, if that makes sense.
Well, I know in the past I've had a couple of claims disputes, and I tried
Handling them myself, talking to the insurance company, and got nowhere, but I called NIPSIA, and they definitely were an advocate for me, and they went in and they fixed it.
Sure, yeah.
So,
Yep, no.
where would that?
Well, the way this would typically work again is you then still call Santa Fe Community College, and then what typically happens is instead of them going through the effort of doing that, they typically would call us and say, we got this question, can you help us go fix it? And we go call the carrier and figure out what's going on. And so again, there's an incremental more high touch, if you will, but the services still, if they do it and designate it right, largely are still being outsourced, if you will, just like NIPSIA is outsourcing it today. Yeah.
Yes, I'd like to know a little bit about calendar benefit services. So it sounds like you would sort of take the administrative portion where NIPSIA used to do it, from what you're saying. I've got a couple questions along with the company.
Sure.
You also said that you've worked with New Mexico schools before. So if you could share that, and are these schools we can contact?
Sure. Again,
And how do you get paid? Do we pay you? Do the insurance companies pay you?
fair question. No, so in terms of the work, we've been working in New Mexico for over 20 years. We've worked with the state of New Mexico. We've worked with, actually we've done project work in the past for NIPSIA. We work currently with Los Alamos County. We work currently with Santa Fe County. We currently work with Bernalillo County, the city of Rio Rancho, Doñana County down in Las Cruces. I mean, we probably have more large governmental business than any other vendor in the state, period. In terms of what we do, we aren't really an administrator, but we are really more of an augmentation and a technical advisor. So what we do is we represent our clients in terms of helping them understand what is prevailing practices, how should you design plans. We have actuarial resources that help you design and forecast and predict what the costs are going to be. We help do all those kind of things. We then provide you all the compliance resources because there's a tremendous amount of compliance stuff that comes along with this stuff. And by the way, NIPSIA addresses some of those today, but some of those are not addressed by NIPSIA. They still fall back on Santa Fe anyway, so it's not an all or none. So it really what we do is sort of strategy, We support kind of competitive analysis. We provide administrative augmentation, I would call it that way. And then we provide some substantial amount of compliance work, and then finally underwriting and actuarial resources to support our clients. And finally, who have we worked? We've also worked with UNM. We've worked with NMSU on a project basis. New Mexico State is currently in the state pool. So again, they're in this situation you are, except they're in the state instead of NIPSIA. But we've done other project work for NMSU and continue to do project work. And we've also done extensive work over the years in the past with UNM. So I think our credibility certainly kind of is solid. In terms of how we get paid, the way we get paid is very much a function of directly with our clients. We negotiate a fee, we're paid a fee, we are not paid by vendors, we don't accept commissions. So we are agnostic to who you select. That's not why we're here. We want to make sure we help you select the best vendors. And we then build in our fees into your overall budget to make sure that that's part of the total cost analysis. But we are paid strictly and directly by our clients, not through commissions or indirectly. Does that answer all your questions? Yes. You bet.
As you're aware, New Mexico is a medically underserved area. So I guess I'm just going to voice a concern when we changed plans. You know, my family opted to go with Blue Cross Blue Shield as opposed to say Presbyterian, just because we felt like we could have a better, more providers in more areas, more flexibility to travel without the risk of having to engagement with an out-of-network provider, you know, things like that. You know, I remember having my first child and being charged, having to have a C-section and being charged an out-of-network for the anesthesiologist. And, you know, it's like you don't want to walk into a room and and middle surgery and say, everyone get out who's not in network. So I just voice, obviously you can't answer that, but I would just voice that as a concern. Yeah.
And as I mentioned, provider disruption is certainly, I mean, it's hard to quantify in dollars and cents what that means, but it's certainly not escaping what is going to be an important consideration. So, affirmed. What is a potential savings? It's not necessarily been. Right. Yeah. Right. Yeah. And again, we're not saying necessarily that you would select all the carriers that get you to the 12% either, because part of the decision is how much is 12% savings worth versus the potential impact that it might have. And those are hard to measure, but at the same time noted. Oh, I'm sorry.
Staying where we are is a given, but if we would do that, then we would possibly be hiring you guys. So is there a conflict of interest there that you guys are involved in recommending something that you're looking to get money from?
Yeah, I don't think so, because we've done this same analysis in New Mexico for I think 5 other entities, and 2 of them we've come back to them and said we don't see any value in moving. I mean, no. So I mean, I'd like to believe our data speaks for itself, and then we don't make the decision. It's the client who makes the decision. But
I wanted to say something about the carriers also, because I've experienced now that you have to go to Albuquerque because we don't have what Albuquerque has as far as the doctors and medical and stuff like that. And with them bringing in Presbyterian in and stuff, it's made a huge difference and stuff. So I think it needs to be considered about what we've been doing, because I don't want to have to go to Albuquerque or Espanola or Los Alamos every time I need to go to a doctor. I want to be able to go within 10 miles of my home. And so we need to take that into consideration also about what we're doing and what's going on here in Santa Fe. Because there's times when, you know, you can't get the doctor here. They don't have providers under your plan. So I think that's important to look at. The other thing I wanted to ask about is you're talking about comparing apples to apples. When did you start looking at this for the college?
we started the process probably early 2017. We actually started discussions late in 16. I think early, probably February, March, I'm thinking. And what we've done is we went back and looked at some of the changes that NIPSIA made in 16. They've made some additional changes in 17. I believe there's some additional changes that they're contemplating for 18. So we've factored all those changes in as best as we can to make sure, again, we're comparing at a point in
Because
time
what
to
happened
NIPSIA.
to us was we just got an increase, so I mean, you know, you're wanting to compare apples and apples to give us that rate, but what, can you compare apples to apples and give us the rate we had before they did the increase? You know, our deductibles went up, our co-payments went up, our prescriptions went up, all of our out-of-pocket expenses went up. So are you looking at giving us a better rate for our out-of-pocket, for taking us back to before our increase, or are we saying, this is where we are now, this is what we're gonna work with, we're not gonna look back at giving you the better out-of-pocket expenses, we're looking at this right now because that's what we want to deal with.
Right. Great question. So what we are doing, because we can't control what NIPSIA does, so we're saying, what would it cost to replicate what we're getting from NIPSIA today? Because that's the only way we believe you can truly compare value, right? Now, again, my point that I mentioned earlier is if you were to make the decision to withdraw from NIPSIA, now the question becomes, then do we offer exactly what we're getting from NIPSIA or not? And the answer is, you decide. Now, that said, if you reduce deductibles or improve benefits, there's a cost associated with that, and then that's part of the decision-making process. Would you rather have a higher premium and pay for more or not? And those are the decision points that you now at least, I'm not saying what the decision would be, I'm saying you at least have the ability to make those decisions or have those discussions.
Okay, and I just have one question for the executive committee. How many of the staff and employees are involved in what you're going through right now? Is it just the executive committee, or is there any feedback from employees right now, staff, what's going on, what our input, is anybody involved besides the executive committee?
So we're just now to the point of being able to get input from others. So there's a link that's on Jack for you to provide feedback based upon what you heard today and what you'd like to see in the future. But at this point in time, we're only tagging along with CNM's process and looking at what are the opportunities of either staying with NIPSIA or pulling out of NIPSIA. If we decide to pull out of NIPSIA, then there's a whole lot of decisions that have to be made. Some might have to be made soon in terms of pulling out of NIPSIA because we have to let them know. But we will have, put together some groups to look at that. But this is just the first step, and we haven't even gotten to the point of being able to release any information because it's in a confidential procurement process at this point in time. We do have 2 or 3 people participating on the committee with CNM.
It's me and Alicia.
Okay, we have.
Me and Alicia from SFCC.
Okay, so we have 2 people that are participating on the group with CNM. CNM has led the effort, so we're trying to see if by tagging along with them, can we get any benefit from doing that? Okay, but this is like first step.
Randy, can I ask
Yep.
So how does that factor in with the teachers and the union? So
Whatever benefit.
go with your union to decide this, and then how does staff?
Don't know. Don't know. Right now, Santa Fe Community College offers benefits to its employees. Employees get to decide whether they participate or not. And right now, because of the plan we have with NIPSIA, you get to decide amongst 3 different vendors and a couple types of options, high and low options, I think, within those vendors. And so, if we pull out of NIPSIA and we go with one vendor, then we're going to have to negotiate what the plan looks like. And so it's back to your question, if we want to change the plan by lowering co-pays and lowering deductibles, it's going to raise the rates. And so we have to balance those 2, and then what coverages are there that opens it up.
So your slide said in the range of 12 to 22% potential savings.
12% is the max.
12% saving or a 22% increase.
Okay. If we went with a plan and there were savings, are we anticipating that is sort of equally distributed between the college and the employees, or would the college be saving the money? How we anticipate?
So we are mandated by state law as to what percentage the college has to cover. And it's anywhere from 60 to 80%, am I right? And I think it's pretty close to it. It depends on what your annual salary is. So we're mandated, so if your premium is $1,000, if it's going to pick an easy number, and the college has to pay 80%, we pay $800 and you pay $200. And it's, taken out of your biweekly pay periods, except for the 2 months when there's 3 pay periods, if I remember that correctly. So.
Essentially both sides of it.
would get the savings. But there's a lot of other issues related to this that we don't want to get into now in terms of fully insured versus self-funded. If you're self-funded, you want to create a pool so that you have the years when you're short, you have money to go take from. You don't have to go charge everybody additional money. A variety of things there, and so those are all part of the issues of deciding whether we stay with NIPSIA, pull out an NIPSIA, and if we pull out an NIPSIA, then there's multiple decisions that have to be made then. Correct. The savings are the same. So whatever your premium is, you still pay the same percentage you're paying now, unless you get a raise and move into a higher category in which you pay less or more.
So you would think of it as like you're getting a 20% savings off that savings.
Yes.
So what do you think that 12%?
Well, you get a percentage of the 20%, or you pay a percentage of the increase. I mean, as we all know, healthcare costs are not going to go down in the long term. So, I think one of the things I want to say in terms of this is a decision we need to make fairly soon, and that is, are we going to stick with NIPSIA for another year or not? We have to let them know by September 30th. That's an annual thing. But the other issue there is, then if we're not going to stick with NIPSIA, then what are we going to do? And from a college standpoint, we want to provide the best coverage we can at a cost we can afford. And that cost is both the college's cost and you as individual insurers. Not everybody participates. We have about 300 people, or just over 300 people, that are on the insurance policy, and yet we have probably closer to 500 employees who would be eligible to participate. So people are on other insurance. They're on their spouses or something else. So not everybody participates. Okay? But if we move away from NIPSIA, there's a lot of work and a lot of decisions that have to be made. Including, are we just going to tag along with CNM, or are we going to try to design our own offerings, and what does that cost, and what can we afford? What can we afford as a college? What can you as individuals afford? Okay.
I was curious about we found our risk pool to be lower overall than NIPSIA's risk pool, and what's CNM's risk pool look like? Does that make sense?
Yeah, and I don't want to get into great detail with it, but I would say, generally speaking, the question was, can you share any comments on how our risk pool looked like compared to CNM and how it compared to NIPSIA? What generally we found, and again, history isn't a perfect predictor of the future, but it's indicative, right? The history, the last 2 to 3 years of historical claims suggested that your experience was not worse than NIPSIA, but not particularly better. So it was kind of tagging along, if you will. Okay. CNM, their experience actually was meaningfully better, and part of that's not surprising when you think about where NIPSIA is. And NIPSIA is across the entire state. CNM, all their employees, or virtually all their employees, are aggregated right in Albuquerque. There's different purchasing dynamics and so forth. So part of it is just geographic concentration, and then part of it is also possibly their demographics and the utilization. Okay? Yes?
You had mentioned that you did your best to compare apples and apples.
Mm-hmm.
But somebody mentioned recently that within NIPSIA and within the plans that we have to choose from, there are 2 levels. There's a high option and a low option. How did you balance that?
We basically asked them to mirror. So, for example, carrier A, we said, give us high and low option that mirror the high and low options today. And then we just basically took and assumed, for simple purposes, that everybody who's in the option today would still want to be in the high option, and everybody's in the low option would go to the low option. Now, elections will change that naturally, but that's the best way we can do it, to sort of, and the only reason we did that was then to roll up the cost and figure out annually what would the cost be. But we looked at the rates themselves, and then we looked at what we think the annual cost would be based on the rates. But we asked them to, again, not only just say, give us the high plan or the low plan, but saying, if we're going to pick you, propose both plans. Does that make sense? Okay.
Yeah, but then it is possible that if we pull out of NIPSIA and we find another provider and we get into negotiations, they might not offer a higher cost.
Well, at this point, part of the RP process was saying, give us firm rates and a commitment. So no, they have committed, they will honor both plans at these rates, at least for 12 months. Now, a year from now, that's another discussion. But for now, yes. There's another one I was here first, so.
Does anybody know how we're distributed among the three carriers now? Like other people at SFCC, other here with Presbyterian, other here with Blue Cross, et cetera?
In general terms, I don't have the percentages in front of me, but Presbyterian is, and correct me if I'm wrong, John, Presbyterian is by far the largest enrolled option. Blue Cross Blue Shield second, New Mexico Health Connections a very small third, if I recall.
Yeah, it's 98% are broken into two.
And they just got added into the plan.
Yeah, I think New Mexico Health Connections was offered for the first time last time, but it's Press, then Blue Cross Blue Shield, then New Mexico Health Connections currently in terms of order. Follow up?
CNM, if they're actuarially better than we are, why would they take us along?
You know, the answer to that is to some degree, I'm probably not the right person to answer the question, but certainly I think they have other provisions in their mind that they think strategically long-term, it could be a win-win, and I will leave it at that. I just think there are other forces at work that I'm really not at liberty to discuss, but I think part of it, yeah.
I think that we learned that CNM was going to go through this process, and we asked just, hey, can we join you? Kind of just throwing that out there, and they said, yeah, sure. I mean, and so for our benefit, you know, we saw that as something that could really help out our institution here.
Well, actually, the way it came about is that, you know, I want to first of all thank Randy and Nick for allowing us to do the proposal, because as the purchasing office, when I go to the meetings like this, when Randy would talk, people would say, hey, the rates went up, the rates went up, the rates went up. And Randy kept saying, and Nick kept saying, well, that's the best we can do. And I kept saying, well, maybe, you know. So then I approached them and said, well, maybe we should go out and do an RFP. And it took a while for us to do that. So then I called Gallagher Benefit Services, who I work with at UNMH, to do a proposal exactly like this one for UNMH Medical Group and Sandoval Medical Regional Center. So I called them and asked them for, hey, does it work? Is it in the best interest, et cetera, et cetera? Well, at that point, they mentioned that CNM was doing the same thing. So what ended up happening is that I did not want to call CNM because, you know, they're the big dog, right? So fortunately, Gallagher, through their discussions with CNM sent me an email and said, hey, if you want to tag along, let's do it. You know, and that's when I told Randy and Nick and HR, Dan, I said, you know what, this is a golden opportunity for us to determine if the employees are getting the best deal. And you got to remember, the purpose of doing this is solely that. It's not to interrupt your services. It's not to do anything that, you know, to create change. It's to ensure that the exec team, Randy and Nick and Dan, when they look at you, they can say, this is the best deal. You know, and then we checked, we verified, we validated, and we had a third party who is doing the best job they can to compare it apples to apples, whether it's low, high, using current information, and tagging along with a big monster like CNM. And you know, and if we can't get a better deal right now with CNM, then we're sure as heck not going to get it on our own. You know, but again, remember, this is being done for you, the employee. It's not being done to change anything. If it requires change, well, it's going to be a collective decision. It's going to be in the best interest overall to the employees. It's not going to be for purchasing Randy or Nick.
And I also think that it has a lot to do with sort of like one thing that the finance office is always considering, and that is sort of risk management for the institution, for the employees. You know, if we don't go through this process, we just take what we get from NIPIA, you know. And one thing that we do in the executive team and my discussions with Randy is we weigh in to consider legislative situations, the legislative environment. NIPIA gets funding through the state legislature. And you know how things are going with that situation right now in terms of budget and things like that. I think that's a real big consideration. And I'd like Don to comment on if you can, comment on some of the ways that NIPIA has been financing things in order to keep the rates low. I think just from my outlook, I think there's a really good chance that those rates are going to go up no matter what with NIPIA as a status quo. So that's been another thing that we've been trying to look at in terms of our strategic outlook for the college and employees.
Yeah, as far as NIPIA, again, what I can share, just because it's in a public record that I saw, so I only want to speak to that level. But I'm not sure. I think it was probably fiscal year 15, 16, I think is what it was. But one of the 2 years. So they looked at their underlying costs, and the costs were going up. And they said, wow, that's a big nut to pass along to our member employers. They looked at the reserves, and they said our reserves, because we hold additional reserves as a self-insured entity, our reserves are pretty healthy. So let's basically artificially lower the cost from what we think the costs are going to be, and we're going to use some of the reserves to basically supplement what the real costs are going to be. So essentially, instead of charging this, they charge this, and then you use this little reserve to basically fill in the gap. Well, that's fine, but what that does is gives you a potential artificially favorable view of what the world is, because think about this, healthcare costs, as has been mentioned, don't go down. As they continue to go up, let me just do it by way of an example. If the cost is $100 and they only collected $95 of revenue to support those $100, and they use $5 in their reserve to fill the difference in, right? They still get to 100 and everybody's happy. You paid your bills. But the next year, if the costs are now $105, let's say costs went up 5%. Not unreasonable to expect in the healthcare world, right? Well, all of a sudden, if they don't have reserves to then continue to buffer that cost going forward, that means now the revenue that was previously at 95 has to be increased to 105 to cover the full cost. Well, if you think about 105 divided by 95, that's over a 10% increase. And yet costs only went up 5%. So I'm not saying that's what NIPIA is going to do. I'm just saying you do the math, and it does beg the question, how do you sort of find an exit strategy? And that's certainly not for me to say how NIPIA should or shouldn't do it. I'm not going to sit there and tell you what to expect necessarily, other than I looked at this public record and see that data, and it does raise the question. That's really as much as I can share about that. Yeah.
So you may have raised just this when I thought of it, but when you were saying the best case savings is 12%, would that include the additional administrative overhead that we would be responsible for?
It's pretty much as best as we can calculate. It's an all-in cost. If you were to move forward on this basis, all the costs that we can contemplate, they're in. Yes. Yep.
And when you had the proposals come in, and the best one was a savings of 12%, did that surprise you at all? You've got experience in this.
Yeah.
Because if we are now with maybe a better group, have a bigger pool, and we're doing it on our own, should we have gotten something better? Does it suggest that maybe with NIPIA we're kind of right in where we ought to be?
Well, it's a great question. Insurance is an interesting thing, because there's what seems logical on its surface, and that is, what would I buy for the risk? And then the other piece is, can I manage the risk better? That's number two. And then the third question is, do I want to make a business case that it makes a lot of sense because of our organization to make a very aggressive. And we cut down on choices. So the long and short answer is, am I surprised? Not totally, because again, each carrier is going to look at who they're competing against, okay? And I'm going to use a very general comparison here. So if you have carrier X and they see the published rate, which they have, and they saw the experience which came from that carrier because that was part of the disclosure process. And they look at that, and they look at their network, and they say, in our view, we think we have a better managed and or more aggressive network. So for every employee that we don't have today that we could get, we think we can manage that better. So we're going to reflect that in our pricing. Now, if they are ultimately successful or not, I don't know. So that's the general thought that goes into it, and that's a very complicated process. I'm making it very simple, but hope that helps. Yeah, there's one back here first, then I'll go back here.
So it's kind of three parts, but first I want to thank Ed because these are interesting times, basically, right, in terms of health insurance and everything else. But the bottom line is when you say apples to apples and you're saying we're having a savings and it mirrors it, or mirrors similar to save something for us, every year it keeps going up on us regardless, right? That's just the realistic part of this. But I have a question, I'm curious, Mr. Hellman, are you carrying this insurance that you're talking about yourself personally?
Am I carrying
Are
this?
you carrying this, what you're proposing for your family and yourself, one?
No.
And two is, they're building a brand new Presbyterian just down the road here. I'm still kind of in the gray area of what are you really proposing other than kind of something, but I'm not there yet because it's still premature to your premature.
Mm-hmm.
So, let me clarify. And just one last one.
They're not proposing anything.
Right.
They've gone out and done the analysis for it and got the RFPs from these other people. This Gallagher is not proposing.
Okay, I'm
They're
sure
doing the legwork for us to get the quotes in and trying to compare.
So he's not, what I hear is more, the undercurrent is that you're negotiating pretty good. Seems like to me. What I'm hearing you say more aggressive, being versus NIPSIA is like, I'm going to get you this better thing. I'm going to go find out what's going on. And if the federal government came in with this, God knows these Republicans do something maybe right, I don't know. Would that change the whole ballgame of what we're doing here?
That's a lot of questions. So, in terms of our personal coverage, we are an employee just like you. We don't have any say in what we pick. Our corporate offering says, here's your plan, and you pick from that plan. So I don't have, technically I do have one of them, but through a different affiliate, and it's a long story, but I got no control over that any more than you do. So as far as that goes, it's, I'm not sure that has much to do here with that. As far as, are we out there negotiating better or different? Again, what I'll go back to and say, at the end of the day, the large portion of the costs are claims. And so it really boils down to what does the network have in the way of reimbursement rates, and how are they going to manage care, and can they do that at a more effective rate than the next person? That is a very difficult question to answer. And that's why we ask them for both insured rates and look at a lot of different factors. So the answer is, yeah, healthcare is not only changing, but it's changing more rapidly than it ever has and will continue to do. So part of the question I think we would throw back at the college is, with those rapid changes, you can have two choices, and it's not a simple choice, but NIPSIA is going to make what their choices are. And the question is, if there's a valuable reason to pull out of NIPSIA, then you can make the choice. Otherwise, you're going to continue to live with whatever the choices NIPSIA are. And again, I'm not saying you should pull out of NIPSIA. We're just providing data. That's for you guys to make the decision. Okay? And as far as your last comment, as far as what's going on at the federal landscape, something's going to change. I don't know what that is. And I do think that largely the employer landscape probably is not going to be affected meaningfully by whatever comes out of Congress and the executive suite. It really is driving what happens at the individual market. How is it going to affect Medicaid? Will that have a spill-down effect on employers? Yeah, but at a holistic level, not at a real direct specific level. And that's as good as an answer I can give you there. Okay? Sorry. Sure. Fair question, and just in case you couldn't hear her, she said, how long are we locked into a decision? As I understand it, let me kind of go backwards. As far as NIPSIA, as I understand it, and I want to go back and confirm, but I believe if you withdraw there is like a 3-year window before you are allowed to come back and want to get back in the fray. You can, but I think there's a window, I believe, and we'll have to confirm that, obviously. As far as what you're buying and what your commitment to is if you move away from NIPIA, the answer is it's essentially a 12-month contract. So if you purchase it and you don't like it, or when they come back with their renewal to tell you what they want to charge you for 2019 and you don't like it, you certainly have the ability to go look at alternatives and start the process up again. So it's really a 1-year dynamic, if you will. Does that answer your question? Okay. I think you had your hand up for a while, so.
I'm just curious, how many actual insurance providers are in New Mexico now?
You know, there probably are, I would say, I'm not going to give you an exact number, but I would say there's many as maybe 7 insurance entities that are providing medical coverage. There's a ton that provide other insurance, but
How, like 20 years ago, how many were there?
oh boy, probably 4 to 5 times as many. Yeah, I mean, you've seen huge consolidation, huge consolidation. Yeah, and I would even say out of those 6 or 7, what I would tell you is there's really probably more like 4 to 6 that are viable in the larger employer space. For example, there's a couple of carriers that really are more in the individual market. They're just going out and trying to, offer coverage on a retail basis. So you've got basically the 3 you have today, and there's about 3 others that I would say are bona fide insurance companies. So it's 6 to 7. Yeah.
I just want to announce 3 more questions so we can be done by 11:15.
All right, you're going to make me pick the questions, right? I think you've had your hand up for a while.
Summarize the timeline. So by September 1st, we have to make a decision for full out.
Mm-hmm.
So at what point would we have the information we're all looking for? What are the insurance carriers, what doctors would accept those carriers? What are the prices? So when would you have that package possible?
Yeah, well, and again, how the decision is made, I'm going to really defer to the executive team. We're working with the leadership right now to answer the questions they have. How they then ultimately process that and arrive at a decision, I'll defer to them. But I think what we've shared with them is you probably should make a firm decision as to who you're going, if you're going to move out, who you're going to want to go to the dance with by realistically the end of August or early September. And then that would give you the month of September to finalize any plan design changes you do or don't want to make. And then from there, you need to start communicating, rolling this out to be prepared for open enrollment so that you can have the program be effective January 1st. Well, again, I can't answer who we is. I will defer to leadership to say who's making the decision, but
The college, they're making a decision about what insurance we go with without really knowing what the details of the plans would be. That's what it sounds
well, again, we're sharing with the committee a lot of the details, and I have to defer to you.
I want to dispel that. Number one, we're in the first steps of trying to decide what we might want to do. The first decision we really need to make, and we needed some data to back it up, is do we stay with NIPIA or do we leave NIPIA? If we stay with NIPIA, there is no change. We just live with whatever NIPIA's plan is. If we want to leave NIPIA, then there's a whole lot of work that needs to be done to look at who would be that provider. Would it be just one? Would it be multiple providers? How would we be insured? Would we be self-insured? Would we be, what's the other type? Fully insured. But there's a lot of decisions that are going to have to be made in a short time frame. We got into this because we wanted to do some comparisons, and we tagged along with CNM. It may be that we're a year away from making a change decision. We got to start a process, but we have to notify NIPIA by the end of September if we aren't staying with them. So that's our first big decision. The governing board will make the final decision as to what we're going to do. But there's a lot of work. If we decide we really want to step out of NIPIA and go another area, we're going to have to put together some teams to dive into some of this. And the really hardest thing about this is if we're going to go fully insured, I'm not going to divulge any of the details, but if we go with one provider that would give us the 12% savings, there's going to be a lot of people that aren't happy because their doctor's not going to be part of that provider. Okay? So that's That's the real difference. And a couple of the providers maybe have a lot more broader coverage, but they cost more. And so that's why, the thought that we're going to save money, I think is pretty minimal in the long run. No, but that's all built into the apples to apples comparison. So those administrative costs are in there. Okay. There might be a few things that we have to do that we haven't been doing. What's not in there is the cost of all the time and resources to figure out what we want to do. Okay. Let's go here and then we'll go. Yeah. Yep.
I guess I'm trying to just understand the big picture. It sounds like we have to choose between the risk of depending on legislative subsidy to keep the cost down through NIPIA, or the risk of going to the free market, private sector, where we're choosing our providers, and that's regulated maybe by the federal government, maybe it's not regulated at all. But as we make a long-term decision, it sounds like there's some distrust in our local legislator to keep funding NIPIA, and that maybe we'll end up having to pay more and more and more and more versus making a private sector decision.
Well, I think this is my personal opinion on that one. I think that's a little exaggerated on the legislative side. NIPIA has used some of their reserves. The legislature did take some of their reserves back to fund us for this year. So that's one of the reasons we only got a 1% cut instead of a 5% cut. They took reserves from lots of places to do that. So we do have to look at that. It is a free market. Nothing's going to keep healthcare costs from going up. I'm sorry. We're trying to do is manage those costs for the college and the employee and provide the best coverage that we can. And so right now, when you're in NIPIA, we have to go with whatever NIPIA decides. So NIPIA right now has Blue Cross, Blue Shield, Presbyterian, and New Mexico Health Connections. And they have the plans that they offer that you get to pick from in there. We have no say in those. We are either in NIPIA or we're not in NIPIA. Okay? If we go outside of NIPIA, we can negotiate on our own with one company or multiple companies, and we can define the plan the way we want it to look. But the cost could be pretty high if we want to change the plan from what the current choices are. Okay? Doesn't mean we don't want to do that, but it's just, there's a lot more uncertainty at this point in time. We know what the costs are if we keep exactly the same coverage we currently have with NIPIA. We know what it would be. We might be able to negotiate something a little bit better if we went with one company, but there's no guarantees on that. And, if somebody asks about CNM, 1,800 and 300, 2,100 people is a better pool than 1,800. So that's one of the reasons why CNM might like to have us in their pool, because rates would be based upon 2,100 people instead of 1,800 people, which is CNM. So anyway, Jill?
So my question is somewhat related and probably for you. The legislature swept 10 million from NIPIA. I looked up the minutes. Given the financial outlook moving forward, it seems like increasing pressures on the state, not increasing revenue. Is there a point at which you would warn us about this potential continued sweep of revenues from NIPIA? You just don't know.
If you can predict that, we're going to Las Vegas tomorrow. Yeah. Jeff, and let me go here.
Would it be possible for SFCC to do an RFP for 3 vendors that aren't, Blue Cross, Presbyterian, and New Mexico Connections?
So we did an RFP. Gallagher managed it on our behalf, and we got 4 responses. We can't tell that right now because it's a confidential procurement process at this point in time.
And we issued it to more than 4. So we've asked everybody who is a viable player, come on in. Yeah.
But we only had 4 respondents, and we can't make that public until the procurement process is complete.
Many people here, their spouses or domestic partners work for the city of Santa Fe. They have a pool of over 1,200 people. They go with Cigna Insurance, and they have the same or better insurance than we do, but at a lower cost. So a lot of them, or a lot of the spouses, are on the city plan because it's better than our current plan. So, but they got through that process through our RFP process. That's why I was just asking.
So we did an RFP process in conjunction with CNM, and we got 4 responses.
And all the major carriers were included. I'll read between the lines on that. Yeah, good question. Question was, are we talking about all benefits, including medications? Is that a fair way to say it? And certainly the answer is, again, NIPIA offers pharmacy benefits. We certainly are looking to offer pharmacy benefits if we move outside of NIPIA. It would be the same plan design as NIPIA currently offers, unless somebody decides to change it, but for the time being, it would be the same. Now, the question is it exactly the same in all respects? And again, the answer is no. And what do I mean by that? So each pharmacy vendor that you're going to find out there today, NIPIA uses Express Scripts. They have this whole list of drugs that fit into certain tiers. Every other insurance company has their whole list of drugs that fit into certain tiers. They all don't agree on which drug goes into which tier. So there can be, it's typically pretty small percentage of folks, in fact, a very small percentage of folks, but it could be the case where somebody says, I want my drug, and you say, yes, it's covered, but it may fall into tier X instead of tier Y. Now, sometimes it could be better, it could move to a better tier. In some cases, it could go to a worse tier. Those are the kind of things that, again, would happen. It would hopefully be mitigated, and typically the vendor that is being brought in will have a program in place to help work with that member to help manage them through the transition. So the answer is essentially, absolutely, we're providing pharmacy benefits as part of this whole process. If there is a change from the current vendor, there would be incremental change that hopefully be managed, but is it going to be absolutely perfectly the same? No. Okay. I'll let that be the quick.
So in our decisions that we have to make, one of them was, do we want to, if we drop NCA, do we want to partner with CNN or do we want to go out on our own? Does CNN have that choice too? I mean, are we just along for the ride for this discovery phase, and then CNN might go, well, we never intended to partner with you or have you on our plan. We just said you can join us for the discovery phase. So we could actually end up being our little lone, poor little SFCC out there paying 30%.
For our own rates, right?
Yeah, we have rates both if you were to partner with CNM and out. So we know what the cost would be without it, and these numbers actually are showing, these are rates that are specific to Santa Fe, what we showed you, not the rates, but the illustrative costs. Now, if you choose to go with CNM, well, I shouldn't say if you choose, if you and CNM agree in some way to partner, then yeah, that may change that number a little bit, and we can move forward in that path, but you're not contingent upon CNM doing it any more than CNM's contingent upon you.
But it is a cooperative request for proposal. It's a cooperative proposal.
So just want to remind everybody, this is really, I guess, probably step 2 of the process. Step 1 was to go out and get RFPs and get vendors to respond to those RFPs. Now we have to move into step 2. There is a link on Jack for you to provide feedback and questions. We want to use that feedback to decide what are the next steps and what we should consider. And so, what I would encourage you is to ask questions that you think still need to be answered. That's one of the things. We're never going to be able to answer all the questions in all this, but the RFP that was done was to compare what we currently have through NIPIA that is projected for 2018, which with their rate increases, compared with the 4 vendors who responded to the RFP, and it did range from a cost savings of 12% to a cost increase of 22% if we kept the plans exactly the same. Okay, all right.
Is there going to be an increase on the first of the year if we just stay where we have?
Yes, do we know what that is? We built something into the budget. Do you remember what we built into the budget? I'm thinking it's 8% we built into the budget, but I'm not sure.
NIPSI is just north of 4%.
As of today. As of today. I don't think they formally ratified it, but what they have published is that thus far we're anticipating a 4.3% increase in medical rates, I believe.
Whatever they had projected out there in early June is what we built, in May is what we built into the budget for next year. Okay. Yep. One more real quick.
I don't understand the economy of scales. Is it
my understanding is there's about 27,000 members of NIPIA. And so as a result of that, they're able to offer multiple programs, but you're either in or out. You don't get to pick which ones. You can pick the programs, plans they put together. I don't know if you want to add anything.
Yeah. Again, certainly they have some economies of scale in terms of operating costs. Okay. But again, if you think back to what portion of your medical insurance premium is operating costs versus true healthcare consumption, 90%-ish is claims costs. So they have scale on essentially the 10%. But so for example, if I go to carrier A and I say, tell me what we are getting in the way of managed care in terms of what your network looks like, in terms of what the rates are that you pay your doctors. They have the same contracts, the same terms, the same provisions that they're going to give to Santa Fe Community College with your 300 employees as they give to New Mexico, NIPIA with their 27,000 members. So in other words, I go to Dr. X for a $4,000 claim. It's going to cost you $4,000. It's going to cost them $4,000. So the 90% is kind of almost the constant. So how does it change? That's where we get into this mix. So if all of a sudden they look at Santa Fe and they say, well, you know what? Our contracts in Santa Fe are better than they are in Las Cruces and Farmington and so forth. And if all of the employees, generally speaking, I'm not saying all, but the great majority of utilization is in Santa Fe, we think we can manage those dollars better than we can for NIPIA as a whole. So it's really more, it's looking at pockets versus the whole where there may be savings, not are we getting economies of scale. Does that make more sense? No, yeah. It's really because you're buying a little bit different widget in a different place that makes the difference. Okay? Great question, though. All right. On behalf of ours, thank you. Do you have any closing comments?
Yep. Go to the link on Jack.